Umang thought you were checking your own pulse.
Yes, I gathered that, and so I didn't want to go back with it, but I figure I would ask you directly how to avoid picking up my pulse at the same time I'm picking up the client's pulse.
So generally, Andrea, we don't experience our own pulse, right, in the fingers. Generally, if you mentioned you have done the, you must also have done the pulse practice. And when you were here in Mumbai, at that time also you were able to find out your own pulse on the fingertips when you were practicing. At that time also you had the same experience.
Yes, I can also sometimes hear my own pulse, so I understand that I'm an anomaly when it comes to that. And so what I'm trying to avoid is how to not pick up my own pulse while I'm reading the client's pulse.
Right. So in that case, Andrea, sometimes if we are a bit anxious or pitta is high in our pulse, we might notice certain movements or some sensation in our fingertips. So when you are reading the pulse, there are few things which you have to follow. Like you need to be grounded. You need to focus on the patient's pulse, right? Take few deep breaths. You can try that now. Is it every time when you check the pulse you feel that your pulsation in the fingertips?
No, it wasn't every time. It was just a couple of times.
Okay.
Yes, yes.
Then you may be a bit anxious at that time, or your pitta might have got a bit aggravated. Your pulse beat might have got a bit high. So at that time, take deep breath, be focused, grounded, sit in a powerful power position. You know what is power position, right? Sit
Yes.
erect in the table, right? Probably, if you have to see whether you are using your right hand and patient's right hand. So you can probably change the other hand and see. So these are the some of the techniques which you can do, because not always you feel that, right?
No, no.
It's
It
just
I made note of it though. I remember it was one particular guy that came in there. I don't have my notes in front of me. And there was something very unique about him. And so I was able to detect both our pulse simultaneously. And I found that very odd, you know.
means the
You,
client whom you examined.
with that one particular client, I don't have my notes in front of me, but I will make sure I will go back to that and ask Dr. There was something very different about this guy, his condition.
Maybe he had some other condition as well. Sometimes
Yes,
the pulse, yeah, sometimes in some three doshic pulse, Andrea, you feel a very strong, vibration in all the three fingers. So probably that must be the case. So you can
yeah,
share his history later on and we can discuss later on that,
great.
right?
Thank you.
So, yeah. So all are in, Kirti? All are in? Shall we start?
Gina, can you please check? I don't think everyone is here, right?
No, I think most of us are in because
Joseph is not here.
he's traveling.
He's traveling today.
He's traveling today.
And I figured,
So,
but I think everybody else is here. Do you think?
right.
Yeah, I think so.
Yes.
Here, I'll check.
I think Amisha is also not there.
Yep,
Maybe. Yeah,
Amisha.
Okay, fine. So, okay, now before starting the topics for today, I would like to understand from each one of us that those who were there, those who got the pulse reading, they must have been, but those who were not there, like Daniel and Jaina, uh, did you go through the notes, the 5 steps of pulse reading, how to, examine the pulse? Any idea of bit you can share in 5 minutes?
No, I did not go through. I'll be honest, I was not very clear on
Okay.
what, and I kept looking for the recordings and I couldn't find them. So I feel very behind.
Okay, no problem. No, I am asking Jaina because I was supposed to discuss like the pulse when I was doing my case study. Suppose I was going to present the case on migraine and I was going to discuss about the pulse. It's what I felt. But since three of you are not there, I want to understand how much you have understood about this pulse. If not, then probably in the next session when I discuss the case, we can discuss about the pulse. Today I can just tell you about the case and these things, because if I say about the pulse, then you might not grab it more easily. Therefore I was asking.
Well, I did watch it live, but it was in the middle of the night. I'll be honest, I wasn't as cognizant as as I could have been. But I did see, the charts and the pulse, the spiking,
Perfect. Perfect.
Dr.
How about-
Priyanka, every time we learn some, even if it's just one more word or something, I think it will be fine because
I
I
do
know we
too.
won't, I don't expect to understand the whole thing, but I know I'll learn at least one
Perfect.
more thing. Okay.
Right. Yes. So if
Thank
you
you,
all
Anne.
are good, Daniel, you're okay for it?
Yeah, where's which recording is that information on about the
The-
pulse? What you're discussing now?
No,
It was
this-
where
Yeah,
it was
Jaina.
where Cornelia was showing on the course website where it says class. I think it says class recordings, and then you go
Oh.
under the class recordings and it says pulse reading, and then you change the date to the dates that they were in India, and then it will pop up the video.
Okay,
And I
so
didn't
India-
know that.
okay,
Yeah, I didn't know that until
Okay.
just now.
India dates. Okay, I'll look that up.
Okay, fine. So we will
Dana, I
discuss. Yeah.
I just learned that like 3 days ago from Cornelia. So you're really not, everybody's in the same place behind the same place. Don't worry, Jaina. We're all in the same. I found out when I spoke with Cornelia, you're not really behind. We're all kind of a little overwhelmed from all of it, but we'll be able to catch up.
Yes, I would like to request, because I know that Dr. Hamong was saying that, the people that were in India and doing Panchakarma, they're a little bit behind. But I really believe that the people in the States are just as behind, because there just seems to be, I just was uncertain as to what I needed to do other than the course material that, we, had the assignments and I didn't know exactly what we needed to do with the other. So I was just wondering if we could all have that grace, not just the people who were traveling.
Yeah.
Okay. So we will be discussing this case of migraine. So there was this female, she presented herself in the OPD. She had this chronic one-sided headache since past 20 years.
Oh my
Yes, she was sometimes the right side headache, sometimes the left side headache. And the headaches were followed by photophobia, means she did not have any interest, or whenever there was a light, she would feel, just to sit in the dark room. The lights were bit aggravating for, or they were aggravating her headaches. And then she had this nausea feeling. Nausea means a feeling of vomiting sensation at times. And then she also had this trigger attacks by some stressful activity or some sound. If there is a more sound of a TV, or the sound is more of some people fighting, or a children playing in the playground, her headaches were triggered by these activities. Also, before her periods, she also had these bouts of headache, nausea, photophobia. Photophobia means she did not like the brightness of the light. She wanted to be in a dim light. That is called as a photophobia. And with this, she was like socially deprived. She was not able to socialize, because if she goes out, she gets exposed to some sound, marriages, etc. So in short, for the past 20 years, she had this severe headaches, nausea-like feeling, sometimes vertigo, like when she get up from the bed, she used to feel a loss of balance. These were primarily her factors. And when I checked her pulse, I found out heat in the pulse. Heat. Heat is seen in which nadi, Kirti? When you check the three fingers, where you should find pulse, where you find that burning thing. Yes, Andrea?
The middle.
Yes.
Pitta.
It's a
Yes.
thing.
Right. So, see, generally it can be on all three fingers, but the middle finger is a pitta finger and predominantly it is found in the pitta finger, right? Okay, and her vata was 3 up, right?
Okay.
Are you understanding? Vata 3 up, Mary, have you checked? Vata 3 up pulse?
I think I felt it one time that I can
Yes.
remember clearly. Yes.
So can you
Where
please
it
tell
was,
the group how the Vata 3 up pulse is there so others also know, like they can revise and they can understand?
the way I understood it was that it moved up towards the kapha finger, three spaces. So you felt the vata pulse. Then I would feel the pitta pulse. That would be another one up, and then all the way to the kapha pulse. So
Yes, no, it goes away from again from the kapha pulse sometimes.
And
So
so it
Yeah.
goes up to the head, right? It goes to the head, but then once
Yeah.
to the head, then I'll feel it
Opposite
again
the
back at the
wrist.
fata, right?
No, it goes till the head.
To the head.
You know, when you check the pulse, when
Yeah.
the vata is moving towards pitta, second finger, when from the first finger, if it is moving towards the second finger, it is 1 up. When it is going towards the kapha finger, 2 up. And when it is beyond the kapha, it is 3 up, means away from the
It's-
kapha,
Yeah.
right? Okay, good. So, plus there was AMA diagnosed underneath her pulse. AMA again is the blunt-like feeling, a heavy feeling which you get on the fingertips. Heavy feeling. You will not find the pulse smoothly like a thread. You will find our heavy feeling. So these three were seen predominantly in her pulse. That is the 3 up, heat and AMA. Now, seeing the chronicity, she was having this thing from past 20 years. The intensity also was a bit high. So we started with the detox procedure. The detox, since the pitta is involved much, the detox procedure will have virechan and bastis. Because there is a vata and pitta dushti. The vata and pitta are imbalanced in this case. And therefore, we need to do a panchkarma or detox with chiefly virechan and bastis. Now, in some cases, if it is a vata thing, ideally 16 bastis are recommended.
Wow.
If the, yeah, ideally. If it's more of a pitta or kapha thing, even 7 or 8 bastis are ideal. But in some cases of severe vata like arthritis or hip, we generally give 16 bastis. That is called as a kal basti. The 7 bastis are called as yog basti.
Oh, okay.
Yes. So I recommended her for virechan. As you are all aware that what we do in virechan is first we start with the dry potli and paste massages for ama reduction. right? You all must
Yeah.
have experienced that, right? That when we do this dry pind and siddha massages, basically we are reducing ama. We are bringing the toxins from this, we are bringing the toxins or dissociating the toxins which are present at the cellular level. And then we start the ghee thing. Ideally from 3 days or 4 days, depending on the patient's condition, Agni. This ghee will bring all the toxins from the cell to the stomach. We give a purgative medicine 1 day, that is called as a detox day or viration, and you flush the toxins out. Once that is done, now here in migraine-like attack, the aggravated vata takes the pitta to abnormal places. So viration works in both ways. Viration reduces the pitta and it corrects the normal course of vayu or the vata which has been in the wrong course. Viration corrects the course of vayu. Okay. So
Corrects the
in
dose.
course of vayu, vata, right? All you know that 5 types of vata are there. But if 5 territories they have, Kirti, you know that, right? 5 types of vata and the territories. Pran vayu, udan vayu, saman vayu, apan vayu. You know about them, right? But when each vata goes into someone else's territory, then
Right.
it changes its course and it creates some disease. Okay. So in that case, we need to correct the course of vata, bring it in its normal position, and viration helps in that. And then followed by bastis or the enema treatment. Now, after this treatment, after we completed her detox, the intensity and the frequency of her headaches reduced. The earlier she had this attack of migraine every week or twice a week, which now reduced to once in 15 days, and the intensity was not so much. She needed to take some painkillers or NSAIDs to relieve her pain. After that, the herbs were given for almost an year. After that, after the detoxification, the herbs were continued. Now, after a course of 18 months, after the course of 18 months of herbs, her migraine attacks were very, very minimal, like once in 3 months or once in 4 months, triggered by major stress or some change in her diet. So this migraine is something, which if you see from a modern perspective, it's only the painkillers which helps to reduce the pain. The moment you take it, that will help to reduce. If you stop take, sorry. Anyone want to say anything? Okay. So if they are taking painkillers, they are good. If they stop taking it, they still have the intensity of pain. They have this migraine attacks. But here with the detox, basically we are correcting the aggravated pitta, right? And therefore we are working on the root cause, and therefore the doshas are balanced and she does not have any major attacks, major episodes of. Okay, any question?
can I see if I understand? So the person that had migraines often with light sensitivity, sound sensitivity, and it was really debilitating, so that she wasn't socially accepted. I mean, she was accepted, but she just wasn't social because of the sensitivities. So what you were doing was you were helping to not to stop the aggravated pitta by the diet and the herbs. And it took her 18 months of the regimen to be able to reduce them. Can you explain to me what the process, maybe I can understand. So in the pitta phase, you were taking her back through the cycle of the dhatus? Is that what you were doing? No, tell me what was the cycle of being able to reduce the pitta?
No, I mean, you are asking me about the assistance from the modern doctors.
No, I want to know the process. What is the theory behind how do we know the process of reducing the aggravated pitta?
Yes, so for the aggravated pitta, the thing is, see her chronicity, Jena. She had this since past 20 years. So it was a very chronic condition. If I would have helped her only with the herbs and the diet and some home remedies, then it would have taken me more longer. It's not that she would not have shown any results, but it would have taken more longer time. Are you understanding? So here, to break this chronicity, to break this, the intense, because it was triggered by smaller things also. It was triggered by, it was triggered by some stress, some anxiety. So even if it is triggered by some stress or some anxiety, then also she was getting this. And literally it was once or twice a week. The intensity was much, much profound. See, migraines can be, in some case, it can be once a month. Like in some females, it's prior to periods. In some case, it is 1 in 3 months or 1 in 4 months when they are in some stress, when they are exposed to sunlight, or when they're exposed to excessive heat. But here in her case, it was very, very profound. The frequency was more, the intensity was more, everything was a bit higher, right? Now, therefore, it was in her interest, it was better to remove the root cause. If it would have been once in 3 months or once in 4 months, mere our diet and herbs would have helped her. Because then it's the pitta is elevated not much. It's like 20 or 30% more, which we can suppress by our medicines, by our herbs and the diet and home remedies. But here the pitta was almost 70-80% elevated. See the chronicity. See her age. See, because when she met me, she was almost 45. Now, 45 age is again a pitta dominated age, right? The first 20-25 years are kapha dominated, right? And then from 25 to 50 or 55, it's more pitta dominated. And then the next is more vata dominated. This will come in your lecture series, but she's a middle-aged woman. The pitta is more. She was a pitta prakriti also. So in her, pitta condition is more difficult to handle. Also, she was going in that perimenopausal stage where the pitta imbalance also is bit more. So seeing all these factors, the decision was taken to do the detox procedure. And the detox procedure removes the toxins from the root. And Jaina, as you are aware, like we have done many consultations, so you are aware that in most of the pitta conditions, liver is something which is chiefly affected. Because just see, if you see the hormonal changes of the, even in the CA breast, the case which we saw, even in the hormonal changes, somewhere there is this liver pathology. In most of the pitta abnormalities, somewhere the liver is a bit compromised, and virechan is the best way to flush out the toxins and activate the liver metabolism. Are you understanding, Jaina? Are everyone understanding? Okay, perfect. So here, yes, it's just let me finish and then let me, yeah. So here we are removing the toxins. So first, now in 20 years, the toxins also must have reached at the cellular level. And the Dhatu Agni also is getting affected. The cellular metabolism has been affected. So we start with doing the dry massages, removing the toxins, then the ghee thing for 4 days. Then ghee will collect all the toxins, bring it to the stomach, and then we give a purgative called as a virechan. They will pass some motions, the pitta is flushed out, the vata which was haywire is brought into the course, and then the remaining doshas which are there in the large intestine and the aggravated vata, we do basti treatment that will be helpful. Now, even after doing this detox procedure, we are working on 25% improvement because we are doing only the first stage of removal of the toxins, the first R, right? Daniel, the 3 R's, are you aware of 3 R's? Yes, good. Removing the toxins, repair. Now in the repair procedure, I did some herbs with her. In the repair procedure, we give rasayan treatment, wherein the herbs like Shira Shulhar, Pitta Shamak, we give first in the increasing doses empty stomach, and then we reduce the doses. 9 weeks program with the tablets. Empty stomach in the morning, increase doses, start with 2 tablets. Next week, 3, like 3 in the morning, 3 in the evening. 4th week, 4. Next week, 5. So this is called, and then again reducing it to 4, 3, 2, 9-week program. Are you understanding what I mean? Okay.
I am understanding that, but did we talk about that, or was that discussed in India?
We do this Rasayan program after the completion of full detox program. That is the Basti and the enemas. Right?
Okay.
Because
I
once
think
the cleaning is done, then the absorption of these herbs will be more.
I think that's the step that I'm missing regarding the detox. After the detox, I have not understood that step. I guess when I did the detox the other 2 times, actually 3 times,
No,
I
in
didn't have
healthy
that
meat
step.
detox, we don't do that, Jina. In
You
healthy
don't.
meat detox, it's in this detox which we do, the Panch Karma.
Gotcha.
We do this
Okay.
Rasayan program. Yeah, we do the Rasayan program post Panch Karma, and not necessarily in all the conditions. In few conditions, if it is, if it is more of degenerative, then we plan. It depends on the Vaidyas also, how they want to take this thing. But in her case, in this case of migraine, I planned Rasayan treatment of 9 weeks. In that, my main herb was Shira Shulhar. Are you aware of this herb? Shira Shulhar? Shira Shulhar, are you aware? Okay, so this is a herb which we generally advise in people with severe headaches, be it the Vata type of headache, be it the Pitta type of headache, be it the Kapha type of headache. Shira Shulhar works. right? And then you need some other herbs as well according to the doshas which are there in it. Okay, so then this rasayan or the repair phase took almost 6 to 8 months, and then another 10 months in restoring the new cells. So for completion of these three things, removal, repair and restore, it took almost 18 months. And after 18 months, see, her frequency, intensity declined over a period of time. When I say 18 months, it was almost a very reduced pain, like one episode in 3 to 4 months, and not that to a severe episode. For her, it was a bliss. She enjoyed it. That headache was nothing for her when you compare it with the early scenario. Right? So I hope I answered your question, Jena.
You actually did. I assume that on the herbs that you recommend for the doshas, they're going to be different, and they're going to be based on the person and their needs. Is that right?
Yes.
Okay.
Yes.
So, one of the reasons why this case study is very interesting to me is because I was one of those people that would have a migraine once a month for 3 days, once a month with my cycle. And so it's very interesting to me. So what I'm hearing is that the reason for the migraines is because of the toxins in the body. Am I understanding that correctly?
Definitely there are toxins in the body, but there is a more pitta, high pitta, and a vata imbalance. These two will be chiefly there. And some ama. So when we detoxify, basically we are reducing this pitta, high pitta, we are correcting the vata and improving your agni and metabolism, so there is no ama formation. That is what we do. Yes, Andrea, you are asking something?
Yeah, you mentioned that Varachin was one of the remedies utilized, but what if the client, say, had a pre-existing condition of, say, esophagitis or GERD? Would you still recommend Varachin, or would you do something else? Because Varachin might cause damage to her existing esophagitis condition. So
in esophagitis and GERD and esophagitis, we do Virachin procedure unless and until some other condition is different. But in esophagitis, there is an inflammation in the esophagus. In GERD also, gastroesophageal reflux disease is a pitta disorder. So we do Virachin. It's not, but it depends on person to person. If they have other more severe illness or some other existing condition, then the thing which is, then we will skip the panchkarma and we will give the herbs in higher doses and to follow the diet very, very nicely for 6 to 8 months. If suppose this lady had some pre-existing condition wherein the panchkarma wasn't allowed, I would have asked her to be on a strict diet for 6 months. I would have given her smaller detox things like a weekly detox or a mild detox. I would have given her herbs in high doses, right? So these are the plan. If one of the tool is not working among the 6 tools, the other 5 tools need to be adjusted and need to be made more powerful.
Would you require an endoscopy procedure prior to that so you could see how advanced her condition was before?
Yes. In GERD, yes. If she has an associated condition of severe GERD, then we do ask for an endoscopy. In some other cases, we ask for other blood investigations as well, right? So we generally, if we are doing a detox, in some chronic cases with other associated symptoms, we ask for the other investigations. And if that doesn't agree, then we will skip the procedure.
Now, would you want this endoscopy to be within the last month, or could it
No,
be
it's
within 6 months
6
prior?
months. 6 months prior is fine.
Fantastic. Thank you so much, Dr. Priyanka.
Okay. Fine. Any other questions pertaining to this case history?
Yes, I would like to connect my brain to your brain and to Andrea's brain so I understand every bit that you're just saying, because I don't understand it completely. I trust that one day I will.
It's already connected, Jaina.
Yeah, it takes a little.
All of our brains.
Needed to throw a little humor in there.
Absolutely.
Okay. So if there are no questions, can we move to the second case?
Yes.
Okay. The second case is a case of a disc prolapse, right?
Oh.
Disc prolapse. Okay. Vertebra.
So can you explain that a little bit? I'm not really great with that.
Yeah.
Thank you.
Disc prolapse, the vertebra, the spinal cord is made up of many vertebrae, right? Disc prolapse, yes. Many vertebrae. Now, between two vertebrae, there are intervertebral discs, like a cushion with a jelly-like substance in it, which will prevent the friction vertebra, so that two vertebrae doesn't rub against each other. Plus, it acts as a shock absorber, because see, our spine is it holds our body weight, right? So our spine should be very, very it is in a, if you are going in a airplane, or if you are in a car and you hit some things, brakes, bumps, so there should be a shock absorbing which takes this. So this disc, intervertebral disc, plays a major role in it. But in some cases, because of the chronic accumulation of AMA first it is in the intestinal layers, and then gradually it goes and get deposited in the tissues. When it goes and get deposited in the tissues, it tends to make the muscles stiff. When the muscles are more stiff, there is a loss of flexibility. There is a loss of flexibility in the spinal muscles. There is loss of flexibility in the spinal cord, right? And if the spinal cord is more stiff and loss of flexibility, there are chances of this disc prolapse, because if there is more flexible, the intervertebral disc will adjust to the changing thing. But if it is stiff and you get a shock, or you are, even if you get a trauma or an accident, or if you have a fall, the chances of this disc being prolapsed, it can either prolapse in the front side. Like if this is a spinal cord, some of the disc can protrude in the front, either the disc can protrude in the back side. When it protrudes in the front, it is called as an enterolisthesis, right? And when it is in the outside, if you have seen, if we come across some patients who have a MRI, you will be aware of this terminologies. If it goes behind the normal vertebra, it is called as a retrolisthesis. But in either condition, if this disc moves ahead or behind, it puts pressure on the nerves emerging from the spinal cord and supplying to the legs, thighs. Now, there are 5 different vertebrae. When you say of lumbar vertebra, L1, L2, L3, L4, L5. 5 lumbar vertebrae. And from each of these lumbar vertebra, there are set of some nerves which emerge and they supply a particular part of your limb. Some areas they supply the thigh areas. In some cases, the knee, the L3, L4 may supply your toe or the calf muscles. You know, the innervation of the nerves are different. So depending on the area, which area the prolapse is, and on which nerves it is getting pressed, the symptoms may be different in different individuals. Are you understanding a bit about disc prolapse?
Yes, I am. Thank you for explaining. I didn't understand disc. I thought you were saying something else, but no,
Okay.
I'm very grateful that you explained it even more in detail, because even though I was, once you started explaining it, I was aware of it, but with you going into detail, I understood how they're connected to the different body parts, etc. So thank you
Yes.
for the explanation.
Okay. Kirti, you're understanding, right?
Yes.
If not, then please ask. Andrea. Arma. She's today a bit, she had a detox day today, so
Oh,
Yeah, I'm very, very tired.
yes.
I feel, I remember that day.
Yeah.
Oh,
The in front you said was a endolisthesis. Is that what? Could you put in the chat the front and the back what those were so I can spell it
Yes.
right?
That'd be good.
Thank you.
In pink.
Dr. Priyanka,
sorry.
I have a question.
Yes.
So in the woman's pulse, and you said
Mhm.
+3 vata. So
Mhm.
like if it was +1, it would be in the low back, +2 would be going towards the neck, +3 the head. But then, my phone is going down. But you said it went past kapha. Does that mean there's like emotional, or that it's long-standing or something if it goes past 3?
Yes, it was emotional, yes. And therefore it was triggered. Past 3, when it goes, it is emotional, plus some anxiety issues, some this thing. So it was that, and that was triggering her. Yes, you are right, Anne. Good,
Okay.
good. Yes. You got Irma?
Yeah.
Yeah, could you write the back too? Oh,
Right.
it is there. I
It's
see
there.
it now. I see it. Thank you.
Yeah. Okay. Fine. So she this disc prolapse is in age, his age is around 55 years, and he had, when he came to me, he had a severe backache. Whenever he used to sit, walk, severe backache. A radiating sort of a pain from back to legs, thighs, tingling sensation and numbness in his thighs, even in his private parts, because some of the nerves, they supply the private areas also. So he's all the disc L2, L3, L3, L4, L4, L5, almost eventually, almost all of the discs were bit protruded. It was not listhesis. It was not completely out. It was, there's a
Bulging disc.
difference. Protruded. Right, Mary? You are aware of protrusion, right?
Yeah, like a bulging disc, not
Yes.
completely where they collapsed, but it's pushing on
Mhm.
nerves as it bulges out. Yeah.
Yes, exactly. So there was a disc protrusion. The nerves
Right.
were being pressed, and when they bring inflammation on the nerves. And therefore, when the inflammation is there, it has severe pain, tingling sensation, numbness
Yes.
in his thighs, legs. He could not walk even for few distance, for few minutes. The pain would set in. So, plus he had other conditions also, like diabetes. In diabetes also, the nerves are a bit weakened because of the neuropathy,
Right.
plus blood pressure, cholesterol issues. So basically a metabolic disorder wherein the metabolism is very, very sluggish. If you have a dyslipidemia, that is high cholesterol, and if you have diabetes also, then somewhere the metabolism is being affected hugely. So a sluggish metabolism with this disc protrusion and severe stiffness, even his cervical protrusion was there, and he was getting some pain in the neck radiating to his lower head, back side of the head. And he had done sessions of physiotherapy, acupressure, but they were not giving him major relief. The orthopedic surgeon were of the opinion to go for a surgery. But, will he get operated for all the vertebra? Because there's almost all the disc were protruded, almost all the disc. So what, he cannot just replace his entire spine. That will be a bit difficult. So he wasn't keen on doing a surgery. And he visited the Malad clinic. The pulse, if you see, the pulse was of low circulation pulse, LCIR. There was ama. There was vata moving around and high vata pulse. Right? In some cases of disc protrusion, the vata even moves to the wrist. You must have seen vata moving towards the wrist, suggesting the degenerative condition. Right? Have you seen anything in the pulse? Vata moving towards the wrist? Yes?
That's when you can feel it like in the finger.
Yes.
Yeah, on the
Yes.
side of the finger, and you could feel it moving towards the wrist, and that affects from the below the waist, well, into the bottom of the body, right? Isn't it
Yes.
Yeah.
Perfect. Good. So he had these conditions, and again, here it is generally a vata disorder. It is a
Okay.
vata related, chiefly vata related condition. Lot of ama, since he has a metabolic disorder. Understand this. He has he has sugar problem. So his
Right.
pancreas are not functioning well. He has dyslipidemia. So his liver is not functioning well. So his metabolism is very, very sluggish. So lot of ama in the pulse, lot of stiffness in his muscles. And all this led to disc prolapse, high vata condition, pressing the nerves, creating inflammation. Here, the primary objective, you have to treat it. You have to just reduce his aggravated vata, take care of his ama, get rid of the ama and ensure that there is no further ama production. So these two were primary objectives: to bring the vata down and to improve the agni or the digestive fire, so there is no more ama formation. Because even if you are successful in bringing the vata down, you give him herbs, pain mukti mj in high doses, sandhi yog, sandhi care, rasnadi gugul, mahavat nashak. These are the herbs which we give in reducing the inflammation. You give it in high doses, we will be successful in reducing the vata. His pain will be better. He was not keen on doing the panchkarma as well. He was not happy with the diet. He did not want to follow the diet.
Right.
So, okay, so my thing was, let's start with the herbal tablets. And for the initial 3 months, I gave him the tablets. Pain Mukti MJ, 3 tablets thrice. Sandhi Yog, 2 tablets twice. Sandhi Cal, because it was a degenerative change. Sandhi Cal was 2 tablets thrice. Then I gave him Chaitanya Chintamani as well, which works on the nerves, Mahavatnashak, almost all the herbs, so that his pain, his inflammation is brought under control. And it gave him good results. His pain and his discomfort went away. But tingling sensation and numbness were there. Because see, repairing the nerves take a bit longer time. When I
Was
gave,
he obese or was he a obese person?
sorry,
What was this person obese?
not much,
Not much.
not much. But he had this bulge, tummy, huge abdomen, all right? No exercise, sedentary lifestyle. So big tummy putting pressure on his spinal cord, but not obese, not much obese. So his pain was better. But what about the nerves were still inflamed, the nerves were not repaired. His metabolism was still the same, sugar a bit moderately high. So tingling and numbness didn't go. Tingling and numbness didn't go away. He, after 3 months, he said, "Oh, now my pain is better, doctor. That my earlier I had a severe pain while sitting, while walking. I could not walk for my pain is better. But this tingling and numbness is bothering me."
Mhm.
And the stiffness, the ama was still there in his pulse because he wasn't able to. And I told him that, see, if you want to get rid of this thing as well, you need to do a panchakarma. It is very, very crucial. You know, if a patient doesn't want to do the diet and you allow him to, just work on that thing, okay, you don't want to do the diet, forget it. But that will not help him in the long run.
Right.
And, and he was complaining, "Oh no, my pain is still there, my pain is still sorry, my tingling is there, my numbness is there, that is troubling me." Okay, but for that you need to do a full detoxification, and you need to follow a diet for almost 1 month, moong, vegetable and khichdi diet. And he asked me, "Oh, are you giving me guarantee?" Sometimes people or patients, they want guarantee in written. And if you are a bit young, like, if we are a bit young, so they try to, that is a challenge for the young doctors also. They try
Yeah.
to, you must have, they try to, oh, you might not be that experienced, right? So will you give me a guarantee in written? Well, I said, I cannot give you a guarantee. Medical science does not give you, no medical, even your surgeon, a spine surgeon won't give you a guarantee. But I know, I have seen, right? I have treated because I have done this case when I was doing my post-graduation. I have done a post-graduation in Kaichikitsa in Panchkarma in a government college, wherein in a day we were seeing 20 patients of only arthritis, of only backache, 1 month only focus on one disease, 3-year course. So we have that experience. It's maybe sometimes the age, not the age, but the experience also. So he was like, "Oh, if you are giving me guarantee, then I will do." I said, "Okay, see, I know I can do it." But medical science doesn't give guarantees, it doesn't work like that. After much reluctance, his wife was a big follower of Ayurveda, and she had this ankle pain. Now, ankle pain is a small condition. Within 4 or 5 months, she felt good. She followed the diet, she felt good. So she had a good faith. So she convinced him to go for a detox. And we did 1 month detox procedure for him. 1 month complete. I gave him 16 to 18 bastis or enema. 16 to 18 bastis, because this is a vata disorder. Disc prolapse is basically a vata disorder. You need to work on this aggravated vata. And for that, 7 bastis, 5 bastis won't help. You need to correct the vata. You need to remove all the toxins which is there in the intestinal level. Correct the vata properly, and that will help. So I gave him dry potli and paste to reduce the stiffness for arm pachan, we say, to digest the amas. Gave the virechan procedure so that the liver and the pancreatic functioning is enhanced. And then I gave him 16 bastis or 16 enemas. That was the first part of my treatment. I removed the toxins. But then I called him every week for Kati Basti. Kati Basti, spinal dhara, you must have done.
Yeah, yeah,
Yes, right? Kati
yeah.
Basti, where we make a rim of dough, place it on the lower back, pour oil, nourishing all the tissues, nourishing all this intervertebral disc every week. Every week, twice or thrice, I was calling him. I was doing that this Kati Basti and Matra Bastis. Matra Bastis is 60 to 70 ml oil, 60 only oil. There is no
that's the
decoction,
small-
nothing.
Yes.
Yes.
Is that the one that you retain? You put it in at night and you leave it in all night?
Yes.
And then just as long as you can hold it, yeah.
Perfect.
I came up with a bunch of there's ghee in that as well.
You bought the pouches, Mary?
My God, that's another story. They put me in the back room in the airport. They thought I was smuggling things, but I got stopped by the men in black. Yes, and then they had to check my bag. The bottom line is that it was a phone charger. Apparently, you can't put that in your luggage. Never do it. When you guys go home, do not put that in your luggage because it looks like you're planting something. But yes, I did. I came home with a whole bunch of stuff and I swore it was the herbs that were getting me picked off the line. But I have these bottles and part of it I think is the ghee. But if you could just even explain again, the two oils, well, there were two that Dr. Hamong mentioned that they were using in the spinal dhara or the other ones. There were two different types of medical oils that I think it's a one-to-one ratio.
When we do the Kati Basti, chiefly we use Mahanarayan and Balada oil.
Yeah, right.
I will write in the chat. My pronunciation is bit of.
It's tough. And well, I still want to go through the pronunciations of, because everything that I got in India, well, that's in, I guess it's in that language, but I have to translate it to like the same thing. Toxigo has another name and another name. I have to know what, I have to, I get clear on that. And maybe if we even had a sheet on that. This thing is also known as this and as this and as this.
I will share with you, Mary.
Please, yeah, that'll help a lot. And I'm also, while we're talking about spine, I'm trying to make the correlation between when you say the prolapse disc and where this therapy can help, because mechanically it's bulging, it's coming out. And is that just because of an inflammatory situation? Because when you have surgery, they want to put something in, they'll put a rod. Before you know it, you need more surgery because you got to fix it'll affect the one above, and that's why that's always, if you could avoid it at all costs, you're right.
So the bulging will give the inflammation, but there is a disc degeneration as well.
That's why he's got the nerve pain and everything. And how does the Ayurvedic therapy help that?
Can I see if I can answer that? Because it's a vata disorder, the discs are dry. So the oil lays on the skin and goes into the skin to nourish the tissues to balance the vata. Is that okay? So I've got that right. Okay.
Yes, Jaina. Yes, Jaina is good. Right, perfect. She is doing consultations every week, one or two. So very good. Yes. So this is the high vata, which is dry. See, wherever there is a high vata condition, you have to do oiling. Snehan. Right? Snehan means to oil. Sneha also means to love. So people who are high vata, they are not stable. you should shower love them. You know, you can see that also, because high vata people, they are never stable, you know. But
Yes.
snehan, loving, sneha means loving, sneha means oiling. So that helps them more.
Yes.
So therefore, Kati Basti helps, it penetrates in the deeper level, it nourishes the tissues, it nourishes the cells, it nourishes the nerves, it nourishes the disc, plus the Matra Basti, the oil which we insert through the anal region, which stays in the intestine, because intestine, large intestine, is a place where Vata formation is more.
Oh,
Pakwash, large intestine is the place where Vata is formed, right? The major site of Vata. See your first chapter of doshas. The major place of Vata is large intestine. So when we are doing the Matra Bastis, we are nourishing it. Therefore, Matra Bastis help. So for the next 6 months, I was just giving him Matra Basti and Kati Bastis. Right? And then weekly detox with Vaka oil, Virachan tablet. After 6 months, his pain was better in the first 3 months with the herb only. The only thing he was concerning is the tingling and the numbness. After 6 months, it was only 30 to 40% better, not much, because he was a middle-aged man. The Vata is predominant. If the same condition would have been in a 30-year man, it would have become easier. But in a 55-year man, the Vata is more, plus he has a metabolic condition. Still, after 2 years, he's taking few of the herbs. He's still continuing with Matra Basti once in 15 days. But he is pain-free. He doesn't have any tingling sensation unless and until if he does some in the middle, he ran an marathon or something, small distance run. He forgot he had bad issues and he ran. And then
Yeah.
for few months, he had this pain, which we corrected again with the high doses of herbs. So the moral here, the conclusion is that even without surgery, if we are balancing the vata, if we are working on the high vata, if we are working on the metabolic condition, the pain, the tingling sensation can be controlled. But we
Wow.
have to follow all these 3 steps, removing the toxins, which I did in the 1 month of detox, repairing, which lasted for almost 6 to 8 months of Matra Bastis and Kati Bastis, and restoring with the herbs, which is still going on. And he's still on 1 or 2 herbs like Sandhikel and Navjeevan, right? He's still on it after 2 years. So, but without surgery, he's leading a normal life. After 6 months, after I just completed his Matra Basti and Kati Bastis, he was able to go to his office, he was able to walk properly, and then mild tingling, mild numbness gradually in 2 years' time to snap. So in some cases, patience is required. The herb administration takes a bit longer. So both of these cases which I discussed with you are a bit chronic cases. But in severe cases, like in my OPD, I don't know if someone was there. There was this 30-year-old man. In 10 Kati, I did not give any other detoxification. I did not give variation, only Kati Bastis. In 10 Kati Bastis, his pain, his tingling was lost. He's 30-year-old man. There was only a disc protrusion between L3 and L4. 10 Kati Bastis is fine. 3 months of herbs are fine. So we need to understand through the pulse how chronic, how easy it is, or how easily it can be overcome. Fine.
Wow.
So these
I
are
have
the
another,
yeah.
I have another question. We'll finish what you're saying, but I have another question that will take us out.
So I was telling that these are the 2 cases which we are discussed. In both these 2 cases, migraine and disc prolapse, the chronicity was more. Both of these cases required 6 tools of our healing. right? The 6 tools. And
Yeah.
they need to follow 3R formula: removing the toxins, repairing, and renewal.
Restore.
Fine. So that's it. Yeah. Any
Dr.
questions?
Priyanka, I just wanted to mention, you know, I do physical therapy, osteopathy. So if someone came to me with leg pain, you know, I would do all these mechanical things, traction, shift correction, blah, blah. But then the very first couple months that we were even meeting 2 years ago, I got severe pain trying to do yoga. Dr. Clint mentioned something about yoga. So I did an hour of yoga and got crippled. Strict like the symptoms of a spondylosis, like really a slip. And so I'd watch Dr. Naram, and all I heard was detox and don't stop moving. Detox, don't stop moving. So I only knew this 28-day detox, not hours. And I did it. And I kept doing little tiny bits of yoga to keep moving. And one day I tripped and I fell face first, and I felt my disc move into place. And I haven't had a problem there, you know, since. And then when I did the punch karma, I had pain in my here and my knees and my hip and everything. And when I came home, I truly did not have one single pain anywhere in my body. Now, when I got back into my normal routine, these pain came in a little bit of the knees now. So I'd have to come back, I guess, real soon. But I would have been very hard to convince and detox, and that will make this physical disc pain. Like, I would not have believed what you're saying today if I didn't feel it my own self. And one thing I noticed too, while I was in Punch Karma, another osteopath was with me, right? And we kept working on each other physically. And it was crazy because you literally would hear, even something subtle like the head bones or your fingers, you would hear pop, 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 pop. You know, and usually when I treat someone, you might hear a little pop, 1, 2 in a whole session, maybe. We would have like 100, like just so much cracking in the body. So the vata was being released with the panchakarma. And then when we just touched each other, it just pop, 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 pop. So it's hard to believe it, but it's true. The detox, it's even something that seems mechanical and structural. The detoxification is so important. It makes space for things to move back into place, even, you know? And then it's
Yes.
like,
Yes, you're right about it. Yes. Yes, Jana. Yes. You want to ask?
Well, you've mentioned several times about the metabolism. The metabolism is compromised. What is the process to be able to get the metabolism, you know, stimulated and in balance, or whatever you call it?
Agni. Yeah.
So here again, you know, you have to see how much it is damaged, right? Now, if a patient has 20 or 30 years of dyslipidemia, that is high cholesterol and high sugar, and the sugar levels are, you know, in the high range, it means the metabolic, and then the pulse reading, you will get an idea how much the metabolism is affected. So when you say metabolism, it is the liver functioning, the pancreas and gallbladders, they are not working properly. And in some cases, even the cellular Agni, each cell has its own digestive Agni, or you can say own mitochondria and own powerhouse. That also stops working. In that case, when we are detoxifying, when we are following the diet, the ama reducing diet, when we are doing the potli massages, we are removing the toxins, and when we are doing the viration procedure, basically we are removing a set of the layered toxins on the liver, gallbladder and pancreas. We are removing that layer. So that is how we are improving the metabolism. When we are correcting the functioning of liver, gallbladder and pancreas, if they start working in the optimum, the metabolism will be set. In some case, only with the herbs like toxigo or leaf tone or super digest or some healthy meat detox, the metabolism is corrected. In some few cases, even the diet, you give dry ginger water and 7 days of moong and vegetable diet, the metabolism is corrected. All these are the methods. Giving detox tea, CCF tea, putting on 7 days of moong and vegetable diet, giving healthy meat detox, giving some herbs. Now, depending on which stage, how chronic, how strong it is, you have to decide which one to utilize. But all these are methods of improving the metabolism.
Thank you for explaining that. I do have a friend who had gastric bypass, and she has done panchakarma. She has followed the diet. She does take the herbs, but she's kind of at a stalemate. She can't seem to lose the weight. And I think it's because part of the body does, part of her intestines or whatever it is that's gone. So she can't absorb properly.
Yes.
Right.
Do you have any suggestions?
We have
for
to
that?
understand her condition more deeply, Jaina. Like, we have to understand her condition more deeply, her history more deeply, and then probably we can chart out the things which we need to do on her. Okay, we will work on it.
Thank you so much. I will ask her if we can do a consult.
Okay, right. So, any other questions, Andrea?
Well, my question has to do with something else, has to do with the herbs being brought back, so I don't know if this is a good time to ask that question.
Which herbs brought back?
Well, Mary mentioned it. She brought it back in her suitcase. I brought all mines back, hand luggage, and I would not allow them to pass it through the machine. I told them, no, you have to hand check this. This is powerful herbs and so on. And I asked him, I said, would you put your dinner through that? That's radiation. And he said, oh, Ayurveda. So every time, because I flew to Delhi and I had to go through security 3 times, they had to hand check each, I handed them the bags of the herbs and bottles. I brought back like 60, right? And so it bypassed all that. They just looked in the bag and said, oh, I say Ayurveda. And I also do not go through security. I have them hand check me, a woman, of course, pat me, whatever. So one of them tried to say, oh, no, it's okay. It's okay. You can put the medicine through the machine. I said, sir, no, it's not good for it to expose this to radiation. But everybody does. I said, okay, just because everybody does something doesn't mean I'm going to do it, So once he understood Ayurveda, I said, Ayurveda. He said, okay. And so that's how I got through security each time. That's the magic word, is Ayurveda, but not everybody understands Ayurveda. So one didn't understand it. So then I stood there refusing to go through. And then I found someone that looked official, and I asked him, I said, please, can you check my bags? Because this is special medication from Ayurshakti, right? And he said, oh, Ayurveda? Yes, and that's how I got through. So my question, I guess, is, and I already know the answer, but I want your take on it, is it okay for it to go through the machine and be exposed, even though it's small amounts of radiation? What's your take on that?
See, if ideally, if you can avoid it, which you did it successfully, that is a good thing. But in some cases, you cannot avoid it. So even if it is a small part of radiation, if it is there, then it doesn't hamper the quality of the herbs, right? Because the radiation is in a small way, so it doesn't hamper the quality. But since you did it very nicely and you avoided it, that is the best thing.
Yeah, so I just want to let you guys know that you just got to find the most sensible official because the ones The subordinates don't get it. Got to find the official, and who knows, maybe Ayurveda or whatever, and then that's how you get your stuff through without, they just bypass the machine, they take the bag, they just walk it around it, and you pick it up on the other side. And that's how I avoided my stuff going through all that radiation over and over, because I went through 3 times. So you can keep that in mind when you travel.
Good luck with that.
Oh,
I actually brought some things with me that I can put in the suitcase that protect from the radiation. So
Yeah,
my
yeah.
stuff will be protected. Because I don't want to carry all that stuff.
Yeah.
Yeah.
Well, my carry-on luggage had enough room that I could carry that and more, and still keep within the weight allowance. Yeah.
You know, something else that happened to me, you just reminded me of something. When I came over from the United States, I had a backpack and a carry-on, and then whatever luggage that was checked, right? Going back from Mumbai, they told me I could carry one thing on the plane, and it had to be 7 pounds. That's it. And everything else had to get checked and go. Well, this is after they maybe redistribute, and there was many things that kind of happened with that. So sometimes you don't always get that person that you can work with, or that you could communicate with, or whatever, or that wants to even deal with you, you know, and do that. So
You got to do the marma. You got to do
it
the
was a bit of
baggage
a,
check
I
marma.
had Dr. Naram. I was like, okay, I give up. It's your turn now. And that's probably how I got through, but it was a lot of back and forth. And that's with paying a porter service so that they could communicate for me in case there's something I don't want to trip wires. I don't know what they're looking for. But that's another thing. Like, getting out of the country was a very different thing than coming in, which, you know, again, this was my first rodeo on this one, so I learned.
Yeah.
But
That
yeah,
was a surprise. And guess what surprise I got? I give them my PCR paper, and he keeps it. I get to New Delhi and they want it. And I'm saying, well, it's in Mumbai.
oh,
and it's not on my phone. So
I know. I made a few copies of everything for that very problem, so that when things get lost or whatever, yeah. But yeah,
so
it's true.
Rupa, the angel, Rupa, I just called Rupa. Rupa just sent it to them, and that was it.
That's great. Yeah, I'm telling you. Yeah, she does double duty.
okay. Nice sharing, all of you. Okay. So, any other questions regarding our sessions? If no, we can wrap up the session, and then, if you have any queries or in the assignments or something, you can let me know.
I have to go over every assignment from, I don't know how far back. Did you get to catch up, Andrea, on some of the things since you've been home?
I'm in the same position.
Or
Dr.
anybody else?
Priyanka, I am so behind with my assignments. Please do not send me
too.
to the
I
dean.
know, therefore I brought up this. I have got only 1 or 2 people's 1 or 2 session only. So I know I am aware of everything. So
I have
please.
to do a case study too. Yes, case
Oh,
study.
I owe you those too. Trust me, but I will catch
We'll
up
do it. We'll do
by
it.
the end of the 3 years. I promise.
You know, it takes a while to heal. It doesn't happen overnight. Little by little, the tissues detox, they get strong.
Okay, perfect. So, shall we wrap up the session then?
Yeah, okay.
I just
Okay,
want to say thank you, Dr. Priyanka, so much for your mentorship. It's been wonderful. I just so appreciate you being so readily available
Anybody
with
want
my
soup or anything?
questions. So appreciate you.
thank you.
Yes.
One has mung beans too.
Thank you.
Yes, I
L-
wish I got to see you before I left. I thought I was going to be there the one extra day. That's another thing. I left a day earlier than I thought I had to. And it was like, so everything was like scrambling to get it all together. And then off I went in the middle of the night, and that was it.
I know
So-
you didn't even read my pulse, Dr. Priyanka, but I was able to get a hug. So that's okay. So I'll hold on to that hug until I see you again. Then we got to do the pulse thing, you know?
Again,
Sure.
another interesting thing, if I can make that comment, when I was doing Panchakarma, and all of us were, every day our pulses were checked. And depending on what they found, they would change treatments, you know, however that's interesting to me, just what you were looking at, looking for what you said, okay, now we're not going to do this one. We're going to do this, this, and this. And somehow making that connection, hopefully that'll get clearer too for us. But I wanted to let people know that's how that worked out. Yeah.
Okay.
Okay.
Good.
Thank you, Dr. Priyanka.
Nice sharing. Okay.
you.
Bye. Take
Thank
care.
you. Thank you.
everyone.
Bye. Bye. Take care,
Bye.
everyone.
Bye,
you.
bye,
Thank you.
everybody.
Bye, everyone.